We see kids for a number of things. Chronic and recurrent ear infections, probably number one on the list. We see kids also for chronic and recurrent tonsillitis. Occasionally we see people for hearing problems, nasal blockage, obstruction, also neck masses. We occasionally see kids for that as well. So there's kind of a whole host of things we see kids for. For children with ear infections, this is going to be more rampant, so to speak, in the wintertime, simply because children are going to be more likely to get colds, catching them at daycare or whatever. Anything that would make their eustachian tube not work as good as it should can make them more likely to have an ear infection. Allergies can do it as well. So you can get an upper respiratory infection, cold, whatever, or allergies. And so, but the winter is predominantly the worst time for them. Spring and summer seem to be better, but there's still some children that have ear infections even through the summer. If a parent has a child that has high fever and quite irritable, then obviously they know something's going on, but they don't know what's going on, and that would be an indication to have that child checked for potentially an ear infection. When you examine them, look at their eardrum, it's pretty classic what you see. The eardrum is red, bulging, which would be classic for what we call an acute otitis media. And the treatment for that would be antibiotics and then rechecked in a few weeks to, number one, be sure the infection is gone, but more importantly, be sure that the fluid that's associated with the infection resolves. Now, if you have the fluid behind the eardrum that persists for months, then those children would be a candidate for placing tubes. Recurrent ear infections would be another reason that you would put tubes in. With the tubes, part of the procedure that's done while they're asleep in the operating room is to actually suction the fluid from behind the eardrum. So that is part of the procedure. I recommend keeping water out of the ears as long as the tubes are in place. The big thing parents are looking for would be any significant drainage from the ear, which could last more than a few days. And if that does, then that would be an indication that they need to be checked for potential infection. When the tubes are in place, if things are functioning normally, there would be no drainage. Generally, a tube stays in about 6 or 9 months is the average. Now, some can come out sooner than 6 months, some stay in longer than 9 months, and we follow the child throughout that time frame until the tubes come out and until the area in the eardrum where the tube was seals over. Usually, children that have recurrent ear infections are going to outgrow it, so to speak. The big question is, when do they outgrow it? And the average age is somewhere between age 2 and age 4. Their eustachian tube function will improve where they would hopefully have outgrown that. There are certainly teens and adults that still have ear infections that their eustachian tube never began functioning properly, but for the most part, children do outgrow the need for tubes.